I grew up in a family of doctors, so both my parents are physicians. My mom's a psychiatrist, my dad's an internist, so I grew up hanging out with them at their offices. And then I have two older siblings who also chose career paths in medicine. So when it came to me choosing what I wanted to do with my life, I almost tried not to like medicine. And in college, I was a humanities major. I studied religion, I studied health policy. But ultimately, I kept getting drawn back to medicine because it did combine my strengths with what I found meaningful in a career. Science was always my strongest subject. I loved solving puzzles, collecting data. And on the other end, it was very meaningful to me to be there for people at their time of greatest need. And medicine did combine those two, and I ended up choosing medicine in the end. I kind of stumbled upon ophthalmology in medical school. So I was on my summer vacation in medical school, and I was hanging out at home, and I decided I should do something meaningful with this summer vacation. So I was in New York with my family, and I emailed a bunch of doctors in all specialties at various hospitals in New York. And one of the few that responded to me was an ophthalmologist at Cornell, actually. And I asked him, hey, can I do some research with you over the summer? I'm home for the summer. It'd be a good experience. And he said, sure. And so I hung out with him for a summer, did some research. I was exposed to the surgeries, and I realized how beautiful and delicate the surgeries were. I was very fascinated by the pathology that he saw. I thought that the patient interactions were very meaningful, and the relationships that patients developed with their doctor over time were great. And so that was what drew me to ophthalmology. It was kind of an accident, but it was a very fortunate one. As a first-year resident working in the emergency room, I always found the cornea patients to be the most interesting. I always found examining the cornea to be a lot of fun. I find the anterior segment to be very beautiful and elegant. And then as residency went on, we started getting some exposure to cornea surgeries, and I found them to be the coolest surgeries. I found corneal transplants to be fun and interesting. I loved suturing. And also, I found that in cornea, you can restore vision to patients in a way that I didn't see or I wasn't exposed to in other specialties. And just last week, we did a corneal transplant on a gentleman who had only light perception vision for several decades. We did a corneal transplant on him, and within one day, he's able to see several lines down on the vision chart, and that to me is why I chose cornea. In addition to enjoying the surgical and medical management of corneal disease, I'm also very interested in research. I've been doing research kind of throughout undergrad, medical school, residency, and one of the perks of being at Wills is there's such a history and so much data here, and I find it very exciting to be able to mine through data and to discover new trends, new treatment options, new management strategies that have never been discovered before, and that can guide future clinicians and kind of change the way people think and manage patients in the field. So for me, research is really exciting, and I'm excited to keep doing research here at Wills. In Wills Eye, I found a wonderful combination of excellent clinical practice, lots of pathology, excellent trainees to work with, and wonderful research opportunities. And these are all things that I find very meaningful in my practice, and that's why I was drawn to Wills. I love to eat, so I'm a big foodie, and I love trying new restaurants, new cuisines. So I think Philadelphia is a great place to explore that. So every week I'll probably go try a couple of new restaurants a week. I also love to travel, and my family and friends and I often go on trips. I'm actually leaving for Bali tomorrow, very excited. And so exploring new cultures, new foods, new environments are all very fun to me.